owe it to our patients and their families to be knowledgeable about recommending and providing caution in the cannabis space. And it's about our responsibility in the same way we know about other symptom management medications, as well as other things people may be doing to treat their symptoms that may not be healthy for them. And so we need to be able to both advise and caution appropriately.
You can say your name and your,
Do you want me to put my dog down so that he's not like in the...
Okay, it doesn't matter either way.
All right, my name's Alicia Benner.
And what do you do? You're
I'm an inpatient and outpatient palliative medicine physician at Duke.
okay. And how were you feeling about cannabis before the training? What was sort of your baseline? And
yeah, I mean, I think I would say I probably felt moderately comfortable with recommending and discussing cannabis with my patient populations in the clinic that I see. I take care of primarily patients with gynecologic malignancies, Alzheimer's disease, and brain cancers. So those are kind of my areas of specialty. And so I feel fairly comfortable with some of the research in those spaces and some tips about prescribing. But I think learning about, being cautious of drug interactions, I think is really important. That's an area of like a learning edge for me that I definitely need to make sure that I'm checking on, particularly in my patients receiving any kind of checkpoint inhibitors.
yeah.
That was very helpful.
Oh, great. And then, and how are you feeling after the training? You felt like you learned a little bit more about it, more comfortable?
Yeah, and I think it's also prompted me to do some independent research on some of these things for my patients, so that I make sure that I feel knowledgeable enough to be making recommendations or cautioning my patients appropriately. Talking about fat content in meals and how that absorption based on what's in your stomach might impact the speed of absorption and how quick the onset would be, and thinking about the half-life of the gummies and could that be efficacious for prevention of nausea, kind of like olanzapine as a replacement, and would that even stimulate appetite and help for pain? The more we can use one tool for many things, the better.
Especially in palliative, and yeah,
Mhm.
and the older patients, less drugs, the better. Is
Yep.
there anything particular today that any one thing particular that you found the most helpful?
Honestly, just wanting to know about the follow-up study for my GBM patients,
Right?
because I just, they are in a tough place. And so anything promising for them is very exciting for me.
Right. I know, right? That I'm so waiting for that. That's so exciting. Is there anything, anyone watching and curious, what would you tell them about this program?
That I think we owe it to our patients and their families to be knowledgeable about recommending and providing caution in the cannabis space. And it's about our responsibility in the same way we know about other symptom management medications, as well as other things people may be doing to treat their symptoms that may not be healthy for them. And so we need to be able to both advise and caution appropriately.